Hello, future healthcare professionals. Welcome to Diabetes Exam Preparation, your go-to source for mastering the essential knowledge and skills needed for outstanding patient care. In today's video, we'll guide you through 250 true/false questions on diabetes, an important area in managing and understanding one of the most prevalent chronic conditions worldwide. These questions are designed to test your understanding of key concepts in diabetes care, including blood glucose management, treatment options, complications prevention, and patient education. After each question, we'll provide detailed rationales to help you understand not only the correct answer, but also the reasoning behind it, empowering you to apply this knowledge in real-life healthcare settings. Whether you're just starting to learn about diabetes or preparing for exams, this video is packed with insights that will help you build a solid foundation, boost your confidence, and guide you to success. Don't forget to like, share, and subscribe to Diabetes Exam Preparation for more expert-curated resources tailored to your learning needs. Hit the bell icon to stay updated with our latest videos. We're here to support your journey with engaging and practical content. Once you've completed the quiz, share your score in the comments below. We look forward to celebrating your progress. Let's dive into these questions and take a big step toward becoming a confident, knowledgeable healthcare professional. Ready? Let's get started. 1. Type 1 diabetes is characterized by insulin resistance. True or false? Answer: false. Rationale: type 1 diabetes is primarily caused by autoimmune destruction of insulin-producing beta cells in the pancreas, leading to an absolute insulin deficiency, not insulin resistance. 2. Insulin resistance is a hallmark feature of type 2 diabetes. True or false? Answer: true. Rationale: in type 2 diabetes, the body's cells become resistant to insulin, which results in increased blood glucose levels. This is a key characteristic of the disease. 3. A fasting blood glucose level of 100 milligrams per deciliter is considered within the normal range. True or false? Answer: true. Rationale: according to the American Diabetes Association, ADA, normal fasting blood glucose levels are less than 100 milligrams per deciliter. A level between 100 to 125 mg/dl is considered prediabetes. 4. The HbA1c test measures the average blood glucose level over the past 2 weeks. True or false? Answer: false. Rationale: the HbA1c test reflects the average blood glucose levels over the past 2 to 3 months, not 2 weeks. 5. Diabetic ketoacidosis, DKA, is a common complication in type 2 diabetes. True or false? Answer: false. Rationale: diabetic ketoacidosis is more commonly associated with type 1 diabetes due to the lack of insulin. However, it can occur in type 2 diabetes in rare, severe cases. 6. Gestational diabetes typically resolves after pregnancy. True or false? Answer: true. Rationale: gestational diabetes usually resolves after delivery, but women who experience it are at higher risk for developing type 2 diabetes later in life. 7. Insulin therapy is not required for individuals with type 2 diabetes unless they have significant hyperglycemia. True or false? Answer: true. Rationale: many individuals with type 2 diabetes can manage their condition with oral medications and lifestyle changes. Insulin is typically introduced when blood glucose levels are not well controlled with other treatments. 8. Microvascular complications of diabetes include retinopathy, nephropathy, and neuropathy. True or false? Answer: true. Rationale: microvascular complications of diabetes affect small blood vessels and can lead to retinopathy, eye damage, nephropathy, kidney damage, and neuropathy, nerve damage. 9. The onset of type 1 diabetes is usually gradual, with mild symptoms that develop over time. True or false? Answer: false. Rationale: type 1 diabetes typically has an acute onset, with rapid development of symptoms such as polyuria, polydipsia, and weight loss due to absolute insulin deficiency. 10. Metformin is often the first-line medication for type 2 diabetes because it improves insulin sensitivity and decreases hepatic glucose production. True or false? Answer: true. Rationale: metformin is the first-line oral medication for type 2 diabetes. It helps lower blood glucose levels by increasing insulin sensitivity and decreasing glucose production in the liver. 11. Type 2 diabetes is primarily caused by autoimmune destruction of pancreatic beta cells. True or false? Answer: false. Rationale: type 2 diabetes is primarily caused by insulin resistance and impaired insulin secretion, rather than autoimmune destruction of beta cells, which is characteristic of type 1 diabetes. 12. Individuals with type 1 diabetes must use insulin for blood glucose control. True or false? Answer: true. Rationale: type 1 diabetes is characterized by the absolute lack of insulin due to the destruction of beta cells in the pancreas, requiring insulin therapy for blood glucose regulation. 13. A blood glucose level of 126 milligrams per deciliter or higher on 2 separate occasions is diagnostic for diabetes. True or false? Answer: true. Rationale: according to the ADA, a fasting blood glucose level of 126 milligrams per deciliter or higher on 2 separate occasions is diagnostic for diabetes. 14. The primary goal of diabetes management is to maintain normal blood glucose levels without the use of insulin. True or false? Answer: false. Rationale: while maintaining normal blood glucose is the goal, some individuals with diabetes, especially type 1 diabetes, require insulin for proper management. Type 2 diabetics may use oral medications or insulin depending on the severity. 15. Exercise can help lower blood glucose levels by increasing insulin sensitivity. True or false? Answer: true. Rationale: physical activity increases insulin sensitivity, allowing the body to use glucose more effectively and lowering blood glucose levels in people with diabetes. 16. The presence of ketones in the urine is a sign of diabetic ketoacidosis, DKA, in type 1 diabetes. True or false? Answer: true. Rationale: in type 1 diabetes, diabetic ketoacidosis can occur due to insufficient insulin, leading to the production of ketones as a byproduct of fat metabolism. Ketones are often detected in the urine in this condition. 17. Individuals with type 2 diabetes have a higher risk of developing cardiovascular disease. True or false? Answer: true. Rationale: type 2 diabetes increases the risk of cardiovascular disease due to factors like hyperglycemia, dyslipidemia, and hypertension, which can damage blood vessels and the heart. 18. Insulin therapy is necessary for managing gestational diabetes during pregnancy. True or false? Answer: false. Rationale: gestational diabetes can often be managed with dietary changes and exercise. Insulin may be needed if blood glucose levels cannot be controlled with lifestyle modifications alone. 19. The hemoglobin A1C test provides a long-term measure of blood glucose control, reflecting the average blood glucose over a 3 to 4 month period. True or false? Answer: true. Rationale: the HbA1c test measures the percentage of hemoglobin bound to glucose over the past 2 to 3 months, providing a long-term indicator of blood glucose control. 20. Diabetic nephropathy is the leading cause of end-stage renal disease, ESRD, in the United States. True or false? Answer: true. Rationale: diabetic nephropathy, caused by prolonged high blood glucose levels damaging the kidneys, is the leading cause of ESRD in the U.S. 21. Type 2 diabetes can often be reversed with significant weight loss and lifestyle modifications. True or false? Answer: true. Rationale: in some cases, significant weight loss, improved diet, and increased physical activity can reverse or significantly improve type 2 diabetes, particularly when caught early. 22. Hyperglycemia can cause dehydration due to increased urine output. True or false? Answer: true. Rationale: high blood glucose levels lead to osmotic diuresis, where excess glucose in the urine pulls water out of the body, leading to dehydration. 23. Diabetic retinopathy is a complication that affects the peripheral nervous system. True or false? Answer: false. Rationale: diabetic retinopathy affects the microvascular system in the retina of the eye, not the peripheral nervous system, leading to vision problems. Peripheral neuropathy, however, is a complication that affects the nerves. 24. Diabetes can lead to both microvascular and macrovascular complications. True or false? Answer: true. Rationale: diabetes is associated with microvascular complications, e.g., retinopathy, nephropathy, neuropathy, and macrovascular complications, e.g., coronary artery disease, stroke, peripheral arterial disease. 25. Metformin should be stopped 48 hours before and after a patient undergoes contrast dye imaging procedures. True or false? Answer: true. Rationale: metformin is typically stopped before contrast procedures to reduce the risk of lactic acidosis, especially in individuals with renal impairment. 26. Hypoglycemia is a potential side effect of oral sulfonylureas used in type 2 diabetes. True or false? Answer: true. Rationale: sulfonylureas increase insulin release from the pancreas, which can sometimes lead to excessive insulin and hypoglycemia, particularly if meals are missed or delayed. 27. Type 2 diabetes is typically diagnosed in childhood or adolescence. True or false? Answer: false. Rationale: type 2 diabetes is typically diagnosed in adults, but the incidence in children and adolescents has risen due to obesity and sedentary lifestyles. 28. The primary defect in type 1 diabetes is insulin resistance. True or false? Answer: false. Rationale: the primary defect in type 1 diabetes is an autoimmune destruction of insulin-producing beta cells in the pancreas, leading to insulin deficiency, not insulin resistance. 29. The use of ACE inhibitors or ARBs in diabetic patients with nephropathy can slow the progression of kidney damage. True or false? Answer: true. Rationale: ACE inhibitors and angiotensin II receptor blockers, ARBs, help reduce blood pressure and proteinuria, which can slow the progression of diabetic nephropathy and preserve kidney function. 30. Continuous glucose monitoring, CGM, is only used in patients with type 1 diabetes who use insulin. True or false? Answer: false. Rationale: while CGM is common in type 1 diabetes, it is also used in type 2 diabetes, particularly in patients who require intensive glucose monitoring or have difficulty controlling their blood glucose levels. 31. A blood pressure of 130/80 mmHg or higher is considered hypertensive in a patient with diabetes. True or false? Answer: true. Rationale: according to guidelines, a blood pressure of 130/80 mmHg or higher is classified as hypertension in patients with diabetes, and it should be managed to reduce the risk of cardiovascular complications. 32. Diabetic foot ulcers are a common complication caused by poor circulation and neuropathy. True or false? Answer: true. Rationale: diabetic foot ulcers are common due to a combination of peripheral neuropathy, which causes loss of sensation, and poor circulation, which impairs wound healing. 33. Diabetes insipidus is the most common form of diabetes in people with type 1 diabetes. True or false? Answer: false. Rationale: diabetes insipidus is a rare condition unrelated to diabetes mellitus. It involves an issue with the kidney's ability to concentrate urine, not blood glucose regulation. 34. Weight loss is often a symptom of poorly controlled type 2 diabetes. True or false? Answer: true. Rationale: uncontrolled type 2 diabetes can lead to weight loss due to the body breaking down fat and muscle for energy when it cannot use glucose effectively. 35. Diabetic patients are at a higher risk for developing infections due to impaired immune function. True or false? Answer: true. Rationale: hyperglycemia impairs immune function, reducing the ability of white blood cells to fight infections, making diabetic patients more susceptible to infections. 36. People with type 1 diabetes are typically diagnosed after the age of 40. True or false? Answer: false. Rationale: type 1 diabetes is typically diagnosed in childhood or adolescence, although it can occur at any age. 37. The primary cause of insulin resistance in type 2 diabetes is excessive insulin production by the pancreas. True or false? Answer: false. Rationale: in type 2 diabetes, the body's cells become resistant to insulin, not because of excessive insulin production. The pancreas initially compensates by producing more insulin. 38. Hyperglycemia and diabetes can lead to an increased risk of infection. True or false? Answer: true. Rationale: high blood glucose levels impair immune function, making it more difficult for the body to fight infections. 39. The main function of insulin is to increase blood glucose levels in the body. True or false? Answer: false. Rationale: the primary function of insulin is to lower blood glucose levels by facilitating the uptake of glucose into cells for energy and storage. 40. The presence of albumin in the urine is an early sign of diabetic nephropathy. True or false? Answer: true. Rationale: albuminuria, the presence of albumin in the urine, is often an early sign of kidney damage in people with diabetes, particularly in diabetic nephropathy. 41. A high HbA1c level indicates poor long-term blood glucose control in a patient with diabetes. True or false? Answer: true. Rationale: an elevated HbA1c level indicates chronic hyperglycemia, reflecting poor long-term blood glucose control. 42. Insulin therapy can only be administered via injection or an insulin pump. True or false? Answer: false. Rationale: insulin can be administered via injection, insulin pump, or inhaled insulin in certain cases. 43. Oral hypoglycemic agents, such as sulfonylureas, can increase the risk of hypoglycemia in patients with type 2 diabetes. True or false? Answer: true. Rationale: sulfonylureas stimulate the pancreas to release more insulin, which can lead to hypoglycemia, especially if meals are missed or insulin is given in excess. 44. Diabetic neuropathy most commonly affects the hands and feet, leading to numbness and tingling. True or false? Answer: true. Rationale: diabetic neuropathy typically affects the peripheral nerves, most commonly in the hands and feet, causing symptoms like numbness, tingling, and pain. 45. In patients with type 2 diabetes, weight loss and exercise can improve insulin sensitivity. True or false? Answer: true. Rationale: weight loss and exercise help to improve insulin sensitivity, allowing the body to use insulin more effectively and control blood glucose levels. 46. The recommended HbA1c goal for most diabetic patients is less than 7%. True or false? Answer: true. Rationale: the American Diabetes Association recommends an HbA1c goal of less than 7% for most adults with diabetes to reduce the risk of complications. 47. Diabetic ketoacidosis, DKA, can only occur in type 1 diabetes. True or false? Answer: false. Rationale: while DKA is more common in type 1 diabetes, it can also occur in type 2 diabetes, particularly in severe cases, such as when an infection or other stressor occurs. 48. The use of beta blockers in diabetic patients may mask the symptoms of hypoglycemia. True or false? Answer: true. Rationale: beta blockers can mask common hypoglycemia symptoms, such as tachycardia and tremors, making it more difficult for patients to recognize low blood sugar levels. 49. Diabetic patients should avoid eating carbohydrates altogether to control their blood sugar levels. True or false? Answer: false. Rationale: carbohydrates are an essential part of a balanced diet, but diabetic patients should focus on consuming healthy, complex carbohydrates and managing portion sizes to avoid blood sugar spikes. 50. In people with diabetes, blood pressure control is important to prevent complications like heart disease and stroke. True or false? Answer: true. Rationale: blood pressure control is crucial for diabetic patients because high blood pressure increases the risk of heart disease, stroke, and other complications, especially in the presence of diabetes. 51. The majority of people with type 2 diabetes are obese or overweight. True or false? Answer: true. Rationale: obesity and being overweight are the primary risk factors for developing type 2 diabetes, as they contribute to insulin resistance. 52. Insulin is required in the treatment of type 2 diabetes only in the later stages of the disease. True or false? Answer: true. Rationale: While type 2 diabetes is initially managed with oral medications and lifestyle changes, insulin may be required as the disease progresses and insulin production or sensitivity further declines. 53. Hypoglycemia in diabetic patients can be treated with glucose, glucagon, or sugary foods. True or false? Answer: true. Rationale: hypoglycemia can be treated by administering glucose or glucagon, in severe cases, to raise blood sugar levels quickly. Sugary foods or drinks can also be used for mild hypoglycemia. 54. Diabetic patients with retinopathy may experience blurry vision and, in severe cases, blindness. True or false? Answer: true. Rationale: diabetic retinopathy affects the blood vessels in the retina and can lead to blurry vision, vision loss, and even blindness if not properly managed. 55. A healthy diet for people with diabetes should focus on high-protein, low-carbohydrate foods. True or false? Answer: false. Rationale: while low glycemic and healthy carbohydrates are encouraged, people with diabetes should focus on a balanced diet with appropriate portions of carbohydrates, lean proteins, healthy fats, and fiber. 56. Diabetic patients are at an increased risk of developing foot ulcers due to poor circulation and neuropathy. True or false? Answer: true. Rationale: diabetic neuropathy reduces sensation in the feet, and poor circulation impairs wound healing, both of which increase the risk of foot ulcers and infections. 57. Diabetic patients should have their blood sugar levels checked only when they feel symptoms of high or low blood sugar. True or false? Answer: false. Rationale: blood glucose levels should be monitored regularly, even when the patient does not experience symptoms, to ensure proper management and prevent complications. 58. Insulin pumps are primarily used for patients with type 2 diabetes who require intensive insulin therapy. True or false? Answer: false. Rationale: insulin pumps are most commonly used for patients with type 1 diabetes, as they provide continuous insulin delivery. However, they can also be used in type 2 diabetes if intensive therapy is required. 59. Women with gestational diabetes are at an increased risk of developing type 2 diabetes later in life. True or false? Answer: true. Rationale: women who experience gestational diabetes are at higher risk for developing type 2 diabetes in the future, particularly if lifestyle changes are not made after pregnancy. 60. The onset of symptoms in type 1 diabetes is typically gradual, with mild symptoms. True or false? Answer: false. Rationale: type 1 diabetes typically has an abrupt onset, with rapid development of symptoms like excessive thirst, frequent urination, weight loss, and fatigue due to insulin deficiency. 61. Type 1 diabetes is typically diagnosed in adults over the age of 40. True or false? Answer: false. Rationale: type 1 diabetes is typically diagnosed in children and young adults, although it can occur at any age. 62. The primary cause of type 2 diabetes is an autoimmune attack on the pancreas. True or false? Answer: false. Rationale: type 2 diabetes is caused by insulin resistance and a relative insulin deficiency, not by an autoimmune attack on the pancreas, which is typical of type 1 diabetes. 63. Tight control of blood glucose in diabetes can help prevent or delay the onset of diabetic complications. True or false? Answer: true. Rationale: tight blood glucose control reduces the risk of developing complications such as retinopathy, nephropathy, neuropathy, and cardiovascular disease in individuals with diabetes. 64. Diabetic patients should avoid physical exercise due to the risk of hypoglycemia. True or false? Answer: false. Rationale: exercise is beneficial for diabetic patients as it improves insulin sensitivity and helps control blood glucose levels. However, patients must monitor blood glucose and adjust insulin or food intake as needed to prevent hypoglycemia. 65. Continuous glucose monitoring (CGM) devices are primarily used for type 1 diabetes management. True or false? Answer: false. Rationale: CGM devices are used in both type 1 and type 2 diabetes, especially in individuals with poorly controlled blood glucose levels or those on intensive insulin therapy. 66. The primary purpose of basal insulin is to control blood glucose levels after meals. True or false? Answer: false. Rationale: basal insulin helps maintain blood glucose levels throughout the day and night, even in the absence of food intake. Bolus insulin is used to manage blood glucose spikes after meals. 67. The Samajai effect refers to morning hyperglycemia caused by nocturnal hypoglycemia. True or false? Answer: true. Rationale: the Samajai effect occurs when the body releases counterregulatory hormones in response to nighttime hypoglycemia, leading to elevated blood glucose levels in the morning. 68. Polyphagia, excessive hunger, is a common symptom of diabetes due to the body's inability to use glucose for energy. True or false? Answer: true. Rationale: in diabetes, the body cannot effectively use glucose for energy due to insulin deficiency or resistance, which triggers excessive hunger, polyphagia. 69. Hyperosmolar hyperglycemic state, HHS, is more commonly seen in type 1 diabetes than in type 2 diabetes. True or false? Answer: false. Rationale: HHS is more commonly seen in type 2 diabetes, particularly in older adults, and is characterized by extremely high blood glucose levels and severe dehydration. 70. The primary treatment for diabetic ketoacidosis, DKA, is insulin therapy and fluid resuscitation. True or false? Answer: true. Rationale: the primary treatment for DKA involves administering insulin to reduce blood glucose levels and correcting dehydration with intravenous fluids. 71. People with type 1 diabetes are more likely to develop diabetic nephropathy compared to those with type 2 diabetes. True or false? Answer: false. Rationale: while both types of diabetes can lead to nephropathy, type 2 diabetes is more commonly associated with diabetic nephropathy due to its longer duration and greater prevalence. 72. Metformin can cause hypoglycemia when used alone for managing type 2 diabetes. True or false? Answer: false. Rationale: metformin typically does not cause hypoglycemia on its own because it works by reducing hepatic glucose production and improving insulin sensitivity, not by increasing insulin release. 73. Hypoglycemia in diabetic patients can lead to confusion, dizziness, and loss of consciousness. True or false? Answer: true. Rationale: hypoglycemia can cause symptoms such as confusion, dizziness, shakiness, and, in severe cases, loss of consciousness due to a lack of glucose available for brain function. 74. Diabetic patients who develop neuropathy should be advised to avoid foot inspections because they may cause discomfort. True or false? Answer: false. Rationale: regular foot inspections are crucial for diabetic patients with neuropathy to identify sores, ulcers, or infections early, as they may not feel pain due to nerve damage. 75. Blood pressure management is not as important in diabetes as blood glucose control. True or false? Answer: false. Rationale: blood pressure management is equally important in diabetes because uncontrolled hypertension increases the risk of cardiovascular disease and kidney damage in diabetic patients. 76. Insulin resistance in type 2 diabetes is typically associated with increased fat accumulation in the abdominal area. True or false? Answer: true. Rationale: abdominal obesity is closely linked with insulin resistance, and excess fat, particularly visceral fat, contributes to the development of type 2 diabetes. 77. Individuals with diabetes who are pregnant should be screened for gestational diabetes between 24 to 28 weeks of gestation. True or false? Answer: true. Rationale: screening for gestational diabetes is typically done between 24 to 28 weeks of gestation to identify and manage high blood glucose during pregnancy. 78. Insulin can be injected into any area of the body, including the abdomen, thighs, and buttocks. True or false? Answer: true. Rationale: insulin injections can be administered in areas with sufficient subcutaneous fat, such as the abdomen, thighs, and buttocks. Rotating injection sites is recommended to prevent lipodystrophy. 79. The use of long-acting insulin can help manage blood glucose levels during periods of fasting, such as overnight. True or false? Answer: true. Rationale: long-acting insulin provides a steady release of insulin to maintain baseline glucose control during periods of fasting or between meals. 80. Diabetic patients are more susceptible to infections due to impaired circulation, nerve damage, and immune dysfunction. True or false? Answer: true. Rationale: diabetic patients are more vulnerable to infections because hyperglycemia impairs immune function, and complications like neuropathy and poor circulation hinder the body's ability to fight infections. 81. A diabetic patient experiencing hyperglycemia should increase their insulin dosage without consulting a healthcare provider. True or false? Answer: false. Rationale: any adjustments to insulin dosage should be made in consultation with a healthcare provider to ensure safe and effective management of blood glucose levels. 82. Glycated hemoglobin, HbA1c, levels below 5.7% are considered normal and indicate optimal blood glucose control. True or false? Answer: true. Rationale: an HbA1c level below 5.7% is considered normal, indicating good long-term blood glucose control and a low risk of diabetes. 83. People with diabetes should avoid drinking alcohol because it can cause severe hyperglycemia. True or false? Answer: false. Rationale: while alcohol can cause hypoglycemia, especially in patients on insulin or oral hypoglycemics, it does not typically cause severe hyperglycemia if consumed in moderation. 84. Diabetic patients with hypertension are at a higher risk for stroke and heart attack. True or false? Answer: true. Rationale: uncontrolled hypertension in diabetic patients increases the risk of cardiovascular events like stroke, heart attack, and heart failure due to its impact on vascular health. 85. Weight loss is a common symptom of well-controlled type 2 diabetes. True or false? Answer: false. Rationale: while weight loss is common in poorly controlled type 2 diabetes, where the body uses fat for energy due to an inability to use glucose properly, it should not be a symptom of well-controlled diabetes. 86. The primary goal in managing type 2 diabetes is to normalize blood glucose levels to prevent complications. True or false? Answer: true. Rationale: the primary goal in managing type 2 diabetes is to maintain blood glucose levels within the target range to reduce the risk of complications such as cardiovascular disease, neuropathy, and retinopathy. 87. Diabetic patients should aim to consume high-fat, low-carbohydrate meals to control blood glucose levels. True or false? Answer: false. Rationale: diabetic patients should focus on a balanced diet with complex carbohydrates, lean proteins, and healthy fats to improve overall health and better control blood glucose levels. 88. Smoking increases the risk of developing type 2 diabetes and worsens complications in diabetic patients. True or false? Answer: true. Rationale: smoking increases insulin resistance and impairs blood flow, which increases the risk of developing type 2 diabetes and worsens complications like cardiovascular disease in diabetic patients. 89. Type 2 diabetes is characterized by an absolute deficiency of insulin. True or false? Answer: false. Rationale: type 2 diabetes is characterized by insulin resistance, where the body does not use insulin effectively, rather than an absolute deficiency of insulin, which is typical of type 1 diabetes. 90. High blood glucose levels can damage blood vessels and nerves, leading to complications like neuropathy and retinopathy. True or false? Answer: true. Rationale: chronic high blood glucose levels can cause damage to blood vessels and nerves, leading to complications like diabetic neuropathy, retinopathy, and nephropathy. 91. Insulin resistance is more common in younger adults with type 1 diabetes. True or false? Answer: false. Rationale: insulin resistance is more commonly associated with type 2 diabetes, particularly in overweight or obese individuals. In type 1 diabetes, the primary issue is the inability of the pancreas to produce insulin. 92. The A1C test provides an average of blood glucose levels over a 6-month period. True or false? Answer: false. Rationale: the A1C test reflects an average of blood glucose levels over the past 2 to 3 months, not 6 months. 93. Gestational diabetes typically resolves after childbirth, but women who have had it are at an increased risk of developing type 2 diabetes later in life. True or false? Answer: true. Rationale: gestational diabetes usually resolves after delivery, but women who have had gestational diabetes are at higher risk of developing type 2 diabetes later in life. 94. Oral hypoglycemic agents, such as metformin, are only used in type 1 diabetes. True or false? Answer: false. Rationale: oral hypoglycemic agents like metformin are primarily used in type 2 diabetes to improve insulin sensitivity and reduce blood glucose levels. 95. Diabetic ketoacidosis, DKA, is characterized by metabolic acidosis, hyperglycemia, and ketosis. True or false? Answer: true. Rationale: DKA is characterized by elevated blood glucose, acidosis, and the presence of ketones due to fat breakdown for energy when there is insufficient insulin. 96. Diabetic patients should monitor their blood glucose levels frequently, especially when they are ill or under stress. True or false? Answer: true. Rationale: illness and stress can increase blood glucose levels, so diabetic patients are advised to monitor their blood glucose levels more frequently during these times. 97. Insulin therapy is not needed for type 2 diabetic patients until they experience complications. True or false? Answer: false. Rationale: insulin therapy may be needed in type 2 diabetes earlier in the disease process, especially when oral medications and lifestyle changes fail to adequately control blood glucose levels. 98. A person with diabetes should consume a low glycemic index (GI) diet to help manage blood glucose levels. True or false? Answer: true. Rationale: a low glycemic index (GI) diet is beneficial for diabetes management because foods with a low GI cause slower, more gradual increases in blood glucose levels. 99. Diabetic patients who are pregnant should only rely on insulin injections and avoid using oral medications for diabetes management. True or false? Answer: true. Rationale: insulin is the preferred treatment for managing diabetes during pregnancy, as many oral hypoglycemic agents are contraindicated due to potential risks to the fetus. 100. The best way to prevent diabetic complications is to maintain good blood glucose control and a healthy lifestyle. True or false? Answer: true. Rationale: consistently maintaining good blood glucose control, a balanced diet, regular physical activity, and other healthy lifestyle habits can help prevent or delay diabetic complications. 101. A diabetic patient with an HbA1c level of 8.5% is meeting the recommended goal for blood glucose control. True or false? Answer: false. Rationale: the recommended HbA1c goal for most patients with diabetes is below 7%. An HbA1c of 8.5% suggests poor blood glucose control and increased risk of complications. 102. People with diabetes are at a higher risk of developing cardiovascular disease due to the effects of hyperglycemia on the blood vessels. True or false? Answer: true. Rationale: chronic hyperglycemia contributes to endothelial dysfunction and the development of atherosclerosis, significantly increasing the risk of cardiovascular disease in diabetic patients. 103. Oral contraceptives may worsen blood glucose control in women with diabetes. True or false? Answer: true. Rationale: some oral contraceptives can increase insulin resistance and raise blood glucose levels, making blood sugar management more challenging in women with diabetes. 104. The initial management of type 2 diabetes includes lifestyle modifications such as diet and exercise. True or false? Answer: true. Rationale: the first-line management for type 2 diabetes typically includes lifestyle changes like dietary adjustments, increased physical activity, and weight loss to improve insulin sensitivity. 105. Insulin injections must always be administered intravenously for rapid absorption. True or false? Answer: false. Rationale: insulin injections are typically given subcutaneously, under the skin, and rapid-acting insulins are absorbed quickly through subcutaneous tissues. Intravenous insulin is typically reserved for emergencies like diabetic ketoacidosis. 106. The presence of ketones in the urine of a diabetic patient usually indicates that the patient's insulin therapy is well controlled. True or false? Answer: false. Rationale: the presence of ketones in the urine is typically a sign of uncontrolled diabetes, often associated with diabetic ketoacidosis, and indicates that the body is breaking down fat for energy due to insufficient insulin. 107. Diabetic patients should avoid eating foods high in fiber because they are difficult to digest. True or false? Answer: false. Rationale: foods high in fiber, particularly soluble fiber, are beneficial for diabetes management as they help regulate blood glucose levels and improve digestion. 108. The treatment goal for patients with type 1 diabetes is to maintain blood glucose levels close to normal by using insulin therapy. True or false? Answer: true. Rationale: insulin therapy is essential for managing type 1 diabetes, as the pancreas produces little or no insulin. The goal is to maintain blood glucose levels as close to normal as possible to prevent complications. 109. Insulin resistance is associated with obesity, particularly abdominal obesity. True or false? Answer: true. Rationale: abdominal obesity, visceral fat, is strongly linked to insulin resistance, a hallmark of type 2 diabetes. Visceral fat releases fatty acids that impair insulin action. 110. Hypoglycemia can cause the release of stress hormones such as cortisol and epinephrine, which may worsen the symptoms. True or false? Answer: true. Rationale: when blood glucose levels drop too low, the body releases counter-regulatory hormones such as cortisol, glucagon, and epinephrine to raise blood glucose levels, which can worsen the symptoms of hypoglycemia. 111. Diabetic patients can safely drink caffeinated beverages without any impact on blood glucose levels. True or false? Answer: false. Rationale: caffeine can temporarily increase blood glucose levels and decrease insulin sensitivity in some individuals, so diabetic patients should monitor their blood glucose when consuming caffeinated beverages. 112. Diabetic patients are advised to wear medical identification, such as a bracelet, to alert others in case of an emergency. True or false? Answer: true. Rationale: diabetic patients should wear medical identification to ensure they receive appropriate care in case of an emergency, especially if they experience hypoglycemia or other complications. 113. Diabetic patients should avoid all fats, including healthy fats like those found in avocados and nuts. True or false? Answer: false. Rationale: healthy fats, such as those from avocados, nuts, and olive oil, can be beneficial for heart health and help with blood glucose control in moderation. 114. Metformin is contraindicated in patients with kidney disease because it may cause lactic acidosis. True or false? Answer: true. Rationale: metformin is contraindicated in patients with severe renal impairment due to the risk of lactic acidosis, a rare but serious side effect. 115. Continuous glucose monitors, CGMs, are more accurate than traditional blood glucose meters. True or false? Answer: true. Rationale: CGMs provide real-time, continuous monitoring of glucose levels and can be more accurate than traditional blood glucose meters, which provide a snapshot of glucose at a single point in time. 116. The risk of developing type 2 diabetes is higher in individuals with a family history of the disease. True or false? Answer: true. Rationale: genetics play a significant role in the development of type 2 diabetes, and individuals with a family history are at a higher risk due to inherited factors such as insulin resistance. 117. People with diabetes are at a higher risk of developing cataracts and glaucoma due to prolonged high blood glucose levels. True or false? Answer: true. Rationale: chronic hyperglycemia can damage the lens of the eye, increasing the risk of cataracts and contributing to the development of glaucoma, both of which are common diabetic eye complications. 118. Type 2 diabetes is more likely to be diagnosed in individuals who are lean and physically active. True or false? Answer: false. Rationale: type 2 diabetes is more common in individuals who are overweight or obese, as excess fat, particularly abdominal fat, contributes to insulin resistance. 119. Insulin pumps are an appropriate form of insulin delivery for type 1 diabetes, but are not used in type 2 diabetes. True or false? Answer: true. Rationale: insulin pumps are commonly used in type 1 diabetes to provide continuous insulin infusion. In type 2 diabetes, insulin therapy is usually administered via injections, though pumps may be used in some cases. 120. Diabetic patients should avoid exercise because it could lead to hypoglycemia. True or false? Answer: false. Rationale: exercise is beneficial for diabetic patients as it helps improve insulin sensitivity and lower blood glucose levels. However, patients need to monitor their blood glucose before and after exercise to prevent hypoglycemia. 121. The primary method for diagnosing type 1 diabetes is an oral glucose tolerance test, OGTT. True or false? Answer: false. Rationale: the primary method for diagnosing type 1 diabetes is based on symptoms and blood tests, such as fasting blood glucose or HbA1c levels. The OGTT is more commonly used to diagnose type 2 diabetes and gestational diabetes. 122. Diabetic patients who are non-compliant with their treatment plan are at an increased risk of developing long-term complications. True or false? Answer: true. Rationale: non-compliance with treatment, including medication adherence and lifestyle changes, can lead to poor blood glucose control, increasing the risk of long-term complications such as retinopathy, nephropathy, and neuropathy. 123. Chronic kidney disease, CKD, in diabetic patients is usually caused by a lack of insulin production. True or false? Answer: false. Rationale: diabetic kidney disease, diabetic nephropathy, is caused by prolonged hyperglycemia leading to damage of the kidney's blood vessels, not by a lack of insulin production. 124. Gestational diabetes increases the risk of the baby developing type 2 diabetes later in life. True or false? Answer: true. Rationale: babies born to mothers with gestational diabetes are at an increased risk of developing type 2 diabetes in adulthood due to genetic and environmental factors. 125. Individuals with type 2 diabetes should avoid carbohydrates altogether to better control blood glucose levels. True or false? Answer: false. Rationale: carbohydrates are an important part of a balanced diet. The focus should be on choosing complex carbohydrates with a low glycemic index, which have a smaller impact on blood glucose levels. 126. Insulin is not required for type 2 diabetes unless the person has advanced complications. True or false? Answer: false. Rationale: insulin therapy may be required for type 2 diabetes when oral medications and lifestyle changes are insufficient to control blood glucose levels, even before complications arise. 127. Patients with type 2 diabetes who experience symptoms of polyuria, polydipsia, and weight loss may need immediate insulin therapy. True or false? Answer: true. Rationale: these symptoms suggest that the patient may have uncontrolled diabetes and may require insulin therapy to bring blood glucose levels under control. 128. The dawn phenomenon refers to early morning hyperglycemia due to insufficient insulin levels overnight. True or false? Answer: true. Rationale: the dawn phenomenon is an early morning rise in blood glucose, often caused by the release of counterregulatory hormones such as cortisol and growth hormone, which can impair insulin action. 129. Diabetic patients should monitor their blood glucose at least once a day. True or false? Answer: false. Rationale: the frequency of blood glucose monitoring depends on the individual's treatment regimen, but many patients, especially those on insulin, need to monitor their blood glucose levels multiple times a day to ensure proper control. 130. Type 2 diabetes is more likely to occur in people with a sedentary lifestyle. True or false? Answer: true. Rationale: a sedentary lifestyle contributes to obesity and insulin resistance, both of which are key risk factors for the development of type 2 diabetes. 131. Insulin is a hormone produced by the liver. True or false? Answer: false. Rationale: insulin is produced by the beta cells in the pancreas, not the liver. It helps regulate blood glucose by promoting its uptake into cells. 132. The A1C test is a measure of long-term blood glucose control and is typically checked every 3 to 6 months for diabetes management. True or false? Answer: true. Rationale: the A1C test provides an average of blood glucose levels over the past 2 to 3 months and is typically used to monitor long-term glucose control in people with diabetes. 133. A fasting blood glucose level of 126 milligrams per deciliter or higher on 2 separate occasions is diagnostic for diabetes. True or false? Answer: true. Rationale: a fasting blood glucose level of 126 milligrams per deciliter or higher is considered diagnostic for diabetes, according to current guidelines. 134. Diabetic patients should be encouraged to follow a low-protein diet to protect kidney function. True or false? Answer: false. Rationale: while reducing protein intake may be necessary for patients with diabetic nephropathy, most diabetic patients can consume normal amounts of protein unless they have kidney disease. 135. Diabetic patients should be advised to avoid drinking fluids that contain sugar, even if they are non-caloric. True or false? Answer: false. Rationale: non-caloric, sugar-free beverages like water, herbal teas, or diet sodas are safe for diabetic patients and can help keep them hydrated without affecting blood glucose levels. 136. When blood glucose levels are consistently high, the body may compensate by increasing urine output to eliminate excess glucose. True or false? Answer: true. Rationale: high blood glucose levels exceed the renal threshold, leading to glucose spilling into the urine, which in turn increases urine output, polyuria. 137. A rapid drop in blood glucose levels can lead to a condition known as hypoglycemic unawareness. True or false? Answer: true. Rationale: hypoglycemic unawareness occurs when a patient experiences a rapid drop in blood glucose without the usual symptoms, which can be dangerous if not recognized and treated. 138. Diabetes is one of the leading causes of non-traumatic lower limb amputations in the United States. True or false? Answer: true. Rationale: diabetes, particularly with complications like neuropathy and poor circulation, is a major risk factor for non-traumatic amputations, as wounds or infections in the feet and legs may not heal properly. 139. The primary goal of diabetes management is to completely normalize blood glucose levels. True or false? Answer: false. Rationale: the primary goal of diabetes management is to achieve a stable blood glucose range that minimizes the risk of complications, rather than complete normalization, which can be difficult to attain in some patients. 140. Diabetic patients should regularly check their feet for cuts, sores, or blisters, as they may not feel pain due to neuropathy. True or false? Answer: true. Rationale: neuropathy can impair sensation, making it difficult for diabetic patients to notice injuries on their feet. Regular foot checks are important to prevent infections or complications that could lead to amputations. 141. Diabetic neuropathy can affect both the sensory and autonomic nervous systems, leading to symptoms such as numbness and digestive issues. True or false? Answer: true. Rationale: diabetic neuropathy can cause sensory symptoms like numbness and tingling, as well as autonomic symptoms like gastroparesis, delayed stomach emptying, due to nerve damage. 142. The use of insulin in type 1 diabetes can be discontinued once blood glucose levels are controlled. True or false? Answer: false. Rationale: insulin therapy is a lifelong necessity for individuals with type 1 diabetes, as their pancreas cannot produce insulin. 143. Regular exercise can improve insulin sensitivity and help reduce the need for insulin therapy in type 2 diabetes. True or false? Answer: true. Rationale: Exercise enhances insulin sensitivity, allowing the body to use insulin more effectively, which can help reduce blood glucose levels and the need for medications in type 2 diabetes. 144. In type 2 diabetes, insulin therapy is typically the first treatment used to control blood glucose levels. True or false? Answer: false. Rationale: oral medications such as metformin are typically the first-line treatment for type 2 diabetes. Insulin therapy is usually introduced later if blood glucose levels are not adequately controlled with oral agents. 145. Hyperglycemia can impair the immune system, making diabetic patients more susceptible to infections. True or false? Answer: true. Rationale: chronic hyperglycemia can impair immune function by reducing the ability of white blood cells to fight infections, making diabetic patients more vulnerable to infections. 146. Diabetes insipidus is caused by a deficiency of insulin. True or false? Answer: false. Rationale: diabetes insipidus is caused by a deficiency of antidiuretic hormone, ADH, not insulin. It leads to excessive urination and thirst, unlike diabetes mellitus, which involves blood glucose regulation. 147. Diabetic patients with high blood glucose levels may experience blurred vision due to fluid shifts in the lens of the eye. True or false? Answer: true. Rationale: high blood glucose can cause fluid shifts in the body, including the eyes, leading to blurred vision. This can be temporary but may contribute to long-term complications like diabetic retinopathy. 148. Diabetic patients are at risk for cardiovascular disease because high blood glucose levels contribute to increased cholesterol and blood pressure. True or false? Answer: true. Rationale: chronic hyperglycemia can lead to dyslipidemia, abnormal lipid levels, and hypertension, both of which increase the risk of cardiovascular disease in diabetic patients. 149. Hemoglobin A1C levels of 6.5% or higher are used to diagnose diabetes. True or false? Answer: true. Rationale: an HbA1c level of 6.5% or higher on 2 separate occasions is used to diagnose diabetes. This reflects average blood glucose levels over the past 2 to 3 months. 150. Type 2 diabetes is more common in children than adults. True or false? Answer: false. Rationale: type 2 diabetes has historically been more common in adults, but the incidence in children has risen, largely due to increasing rates of childhood obesity. 151. The pancreas releases insulin in response to high blood glucose levels after eating. True or false? Answer: true. Rationale: the pancreas releases insulin in response to elevated blood glucose after food intake, facilitating glucose uptake by cells for energy storage or use. 152. Diabetic patients who experience hypoglycemia should eat or drink something high in fat to raise their blood glucose levels quickly. True or false? Answer: false. Rationale: foods or drinks high in sugar or carbohydrates, like juice or glucose tablets, should be consumed during hypoglycemia for a rapid increase in blood glucose, not high-fat foods. 153. Glucagon is a hormone produced by the pancreas that raises blood glucose levels. True or false? Answer: true. Rationale: glucagon is produced by the alpha cells of the pancreas and works to increase blood glucose levels by stimulating the liver to release stored glucose. 154. Diabetic patients should have regular eye exams to detect early signs of diabetic retinopathy. True or false? Answer: true. Rationale: regular eye exams are important for detecting early signs of diabetic retinopathy, a common complication of diabetes that can lead to blindness if untreated. 155. Hypoglycemia is defined as a blood glucose level below 100 mg per deciliter. True or false? Answer: false. Rationale: hypoglycemia is generally defined as a blood glucose level below 70 mg per deciliter, not 100 mg per deciliter. 156. Diabetic ketoacidosis, DKA, is more common in type 2 diabetes than type 1 diabetes. True or false? Answer: false. Rationale: DKA is more common in type 1 diabetes as the absence of insulin leads to fat breakdown and ketone production. It is less common in type 2 diabetes, where some insulin is usually still present. 157. The Samajai effect refers to a rise in blood glucose levels due to counterregulatory hormone release following hypoglycemia. True or false? Answer: true. Rationale: the Samajai effect is a phenomenon where a hypoglycemic episode during the night triggers counterregulatory hormones like glucagon and cortisol to raise blood glucose levels, causing morning hyperglycemia. 158. Metformin is a first-line medication for type 1 diabetes. True or false? Answer: false. Rationale: metformin is a first-line treatment for type 2 diabetes. Type 1 diabetes is managed primarily with insulin, as the body cannot produce insulin. 159. Insulin resistance in type 2 diabetes is often associated with abdominal obesity. True or false? Answer: true. Rationale: abdominal or visceral fat contributes to insulin resistance in type 2 diabetes, as fat cells release substances that interfere with insulin's ability to function properly. 160. Diabetic patients are encouraged to consume a high-protein, low-carbohydrate diet to manage their blood glucose. True or false? Answer: false. Rationale: while moderate protein intake can be beneficial, a balanced diet with healthy carbohydrates, fiber, and fats is recommended for diabetic patients. Excessive protein intake can strain kidney function over time. 161. People with type 2 diabetes can sometimes manage their condition without medication through lifestyle changes, such as diet and exercise. True or false? Answer: true. Rationale: in the early stages of type 2 diabetes, blood glucose levels can often be controlled with lifestyle changes like a healthy diet and regular physical activity. 162. Diabetic patients who smoke are at an increased risk of developing complications such as cardiovascular disease and neuropathy. True or false? Answer: true. Rationale: smoking exacerbates the risk of cardiovascular disease and worsens complications like neuropathy and poor circulation in diabetic patients. 163. Insulin injections should always be given in the same location to ensure consistent absorption. True or false? Answer: false. Rationale: insulin injections should be rotated to different sites to avoid lipodystrophy, abnormal fat accumulation or loss, which can alter absorption rates. 164. The goal of diabetes management is to achieve normal blood glucose levels at all times. True or false? Answer: false. Rationale: the goal is to achieve stable and controlled blood glucose levels within a target range, not necessarily to achieve normal levels at all times, which may not be feasible. 165. Diabetic patients are encouraged to perform regular foot checks to detect wounds or sores that could lead to infections. True or false? Answer: true. Rationale: regular foot checks are essential for diabetic patients, especially those with neuropathy, to detect potential wounds or sores that could lead to infections and complications. 166. Type 1 diabetes is typically diagnosed in adulthood and is related to lifestyle factors. True or false? Answer: false. Rationale: type 1 diabetes is most commonly diagnosed in children or young adults and is an autoimmune disorder where the body destroys its insulin-producing cells. It is not related to lifestyle factors. 167. Diabetic patients should avoid alcohol completely to prevent fluctuations in blood glucose levels. True or false? Answer: false. Rationale: diabetic patients can consume alcohol in moderation, but it is important to monitor blood glucose levels, as alcohol can cause both hypoglycemia and hyperglycemia. 168. The use of long-acting insulin can help manage blood glucose levels overnight in type 1 diabetes. True or false? Answer: true. Rationale: long-acting insulin helps provide basal insulin coverage over an extended period, helping maintain stable blood glucose levels during periods of fasting, such as overnight. 169. The liver plays a critical role in managing blood glucose by storing and releasing glucose as needed. True or false? Answer: true. Rationale: the liver stores glucose in the form of glycogen and releases it into the bloodstream when blood glucose levels are low, playing a vital role in glucose homeostasis. 170. Patients with diabetes should avoid exercise altogether if their blood glucose is elevated. True or false? Answer: false. Rationale: exercise is generally safe for diabetic patients, but if blood glucose is extremely high, e.g., above 250 milligrams per deciliter, exercise should be avoided until blood glucose levels are more controlled to prevent the risk of ketoacidosis. 171. Diabetic patients may experience poor wound healing due to impaired circulation and immune function. True or false? Answer: true. Rationale: poor circulation and a compromised immune response in diabetic patients can result in delayed wound healing and an increased risk of infection. 172. Diabetic patients are more prone to developing urinary tract infections, UTIs, because high blood glucose levels provide a favorable environment for bacterial growth. True or false? Answer: true. Rationale: elevated blood glucose levels in diabetic patients can increase the risk of infections, including UTIs, as bacteria thrive in glucose-rich environments. 173. Diabetic nephropathy typically leads to an increase in urine output. True or false? Answer: false. Rationale: diabetic nephropathy leads to decreased kidney function, which typically results in reduced urine output, oliguria, as kidney filtration declines. 174. Diabetic patients with poor blood glucose control are at higher risk for developing diabetic neuropathy. True or false? Answer: true. Rationale: poor blood glucose control over time increases the risk of developing diabetic neuropathy due to nerve damage from sustained hyperglycemia. 175. Hyperosmolar hyperglycemic state, HHS, is more common in type 1 diabetes than type 2 diabetes. True or false? Answer: false. Rationale: HHS is more common in type 2 diabetes, where the patient has enough insulin to prevent ketoacidosis, but insufficient insulin to control blood glucose levels. It often occurs in older adults with uncontrolled diabetes. 176. Diabetic patients should always eat high-calorie snacks to prevent hypoglycemia. True or false? Answer: false. Rationale: high-calorie snacks are not always necessary for diabetic patients to prevent hypoglycemia. A balanced snack with carbohydrates and protein is more appropriate for raising blood glucose levels when needed. 177. Hyperglycemia in pregnant women can increase the risk of birth defects, especially during the first trimester. True or false? Answer: true. Rationale: uncontrolled hyperglycemia during pregnancy, particularly in the first trimester, can increase the risk of congenital birth defects in the baby, which is why glucose control is essential in gestational diabetes. 178. The risk of diabetic retinopathy can be minimized by maintaining good blood pressure control in addition to managing blood glucose levels. True or false? Answer: true. Rationale: good blood pressure control, in addition to blood glucose control, can help reduce the risk of diabetic retinopathy as high blood pressure exacerbates damage to the blood vessels in the eyes. 179. A fasting blood glucose level of 100 to 125 milligrams per deciliter is considered normal. True or false? Answer: false. Rationale: a fasting blood glucose level of 100 to 125 milligrams per deciliter is classified as prediabetes. Normal fasting blood glucose levels are below 100 milligrams per deciliter. 180. Type 2 diabetes can be managed without medication through diet and exercise for some individuals, especially in the early stages. True or false? Answer: true. Rationale: in the early stages of type 2 diabetes, blood glucose levels can often be controlled through diet modifications, weight management, and increased physical activity. 181. Continuous glucose monitoring, CGM, systems provide real-time blood glucose readings, allowing for more precise insulin dosing. True or false? Answer: true. Rationale: continuous glucose monitoring, CGM, provides real-time blood glucose readings, allowing patients and healthcare providers to adjust insulin doses more precisely, improving blood glucose control. 182. People with type 1 diabetes are unable to produce insulin because their pancreas has stopped producing insulin altogether. True or false? Answer: true. Rationale: in type 1 diabetes, the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas, leading to little or no insulin production. 183. The plate method is a helpful tool for diabetic patients to manage portion sizes and balance their meals. True or false? Answer: true. Rationale: the plate method is an effective way for diabetic patients to visually balance their meals by using a plate divided into portions for vegetables, lean proteins, and carbohydrates. 184. People with diabetes should limit their intake of foods that are high in fiber to avoid digestive issues. True or false? Answer: false. Rationale: foods high in fiber are beneficial for diabetic patients as they help stabilize blood glucose levels and improve digestion. The key is to consume soluble fiber, which has a slower effect on blood glucose. 185. Diabetic ketoacidosis, DKA, can occur in both type 1 and type 2 diabetes, but it is more common in type 1. True or false? Answer: true. Rationale: DKA is most commonly seen in type 1 diabetes due to the lack of insulin, which leads to ketone production as the body breaks down fat for energy. 186. Diabetic patients should always avoid eating any foods that contain artificial sweeteners. True or false? Answer: false. Rationale: artificial sweeteners, when used in moderation, are safe for diabetic patients and can help satisfy sweet cravings without raising blood glucose levels. 187. When administering insulin, it is important to inject it into a muscle to facilitate faster absorption. True or false? Answer: false. Rationale: insulin should be injected into the subcutaneous tissue, not muscle. Injecting insulin into muscle can lead to faster absorption and unpredictable blood glucose control. 188. A high intake of processed meats can increase the risk of developing type 2 diabetes. True or false? Answer: true. Rationale: processed meats are high in unhealthy fats and sodium, which contribute to insulin resistance and an increased risk of type 2 diabetes. 189. Diabetic patients with neuropathy should avoid wearing tight shoes to prevent further nerve damage. True or false? Answer: true. Rationale: tight shoes can increase the risk of foot ulcers and further damage to nerves in diabetic patients with neuropathy, as they may not feel the discomfort. 190. Diabetic patients are at risk for developing infections more frequently due to their compromised immune system. True or false? Answer: true. Rationale: high blood glucose levels can impair the function of the immune system, making diabetic patients more susceptible to infections. 191. The primary goal of treating gestational diabetes is to prevent the baby from growing too large, macrosomia. True or false? Answer: true. Rationale: the main goal in managing gestational diabetes is to keep blood glucose levels within a normal range to prevent complications, such as macrosomia, large baby, which can lead to delivery complications. 192. Eating foods with a high glycemic index will help lower blood glucose levels in diabetic patients. True or false? Answer: false. Rationale: foods with a high glycemic index, e.g., white bread, sugary snacks, can rapidly raise blood glucose levels. Diabetic patients are encouraged to consume low glycemic foods that have a slower effect on blood glucose. 193. Oral medications such as metformin are effective in treating both type 1 and type 2 diabetes. True or false? Answer: false. Rationale: metformin is used primarily for type 2 diabetes, as it reduces insulin resistance and helps lower blood glucose levels. It is not used for type 1 diabetes, where insulin production is absent. 194. A hemoglobin A1C level of 7% or lower is considered well-controlled for most diabetic patients. True or false? Answer: true. Rationale: an HbA1c level of 7% or lower is generally considered a target goal for most diabetic patients to reduce the risk of complications. Individual goals may vary based on patient-specific factors. 195. Insulin resistance in type 2 diabetes can be improved through regular exercise and weight loss. True or false? Answer: true. Rationale: regular exercise and weight loss can improve insulin sensitivity, thereby reducing insulin resistance in type 2 diabetes. 196. Diabetic patients should be regularly screened for kidney function to detect early signs of diabetic nephropathy. True or false? Answer: true. Rationale: early screening for kidney function, including tests like urine albumin to creatinine ratio, is crucial for detecting diabetic nephropathy in its early stages and preventing progression to kidney failure. 197. People with diabetes who experience dizziness and confusion should be immediately treated with insulin. True or false? Answer: false. Rationale: dizziness and confusion can be signs of hypoglycemia, low blood sugar, not hyperglycemia, high blood sugar. The appropriate treatment is to provide a source of glucose, not insulin. 198. The risk of developing type 2 diabetes is higher in people who have polycystic ovary syndrome, POS. True or false? Answer: true. Rationale: POS is associated with insulin resistance and an increased risk of developing type 2 diabetes due to hormonal imbalances and metabolic changes. 199. When managing diabetes, blood glucose levels should be monitored less frequently once the patient's HbA1c is under control. True or false? Answer: false. Rationale: regular monitoring of blood glucose levels is important, even when HbA1c is under control, as it helps detect fluctuations in blood sugar that may not be reflected in the HbA1c levels. 200. The use of sodium glucose cotransporter 2, SGLT2, inhibitors can help lower blood glucose levels in type 2 diabetes by promoting glucose excretion in the urine. True or false? Answer: true. Rationale: SGLT2 inhibitors work by preventing glucose reabsorption in the kidneys, allowing excess glucose to be excreted in the urine, thus lowering blood glucose levels in type 2 diabetes. 201. Diabetic patients are encouraged to eat 3 large meals a day to prevent blood glucose fluctuations. True or false? Answer: false. Rationale: it is generally recommended that diabetic patients eat smaller, more frequent meals throughout the day to help prevent large blood glucose fluctuations and maintain steady glucose levels. 202. Diabetic neuropathy may lead to a loss of sensation in the extremities, increasing the risk of undetected injury and infection. True or false? Answer: true. Rationale: diabetic neuropathy can impair sensation in the feet and hands, which may prevent the patient from noticing injuries or infections, increasing the risk of complications like ulcers and infections. 203. The most common cause of death among patients with diabetes is kidney disease. True or false? Answer: false. Rationale: while diabetic kidney disease is a serious complication, the most common cause of death among diabetic patients is cardiovascular disease, which is often exacerbated by chronic hyperglycemia. 204. Patients with diabetes should drink plenty of water to help prevent dehydration, especially if they have high blood glucose levels. True or false? Answer: true. Rationale: high blood glucose levels can lead to dehydration due to increased urination. Drinking plenty of water helps prevent dehydration and supports kidney function. 205. People with diabetes should avoid exercise altogether if their blood glucose levels are high. True or false? Answer: false. Rationale: exercise can help lower blood glucose levels and improve insulin sensitivity. However, if blood glucose is very high, e.g., greater than 250 milligrams per deciliter, exercise should be avoided, as it could worsen hyperglycemia or lead to diabetic ketoacidosis, DKA. 206. Insulin pumps can deliver a continuous supply of insulin throughout the day and are primarily used for type 1 diabetes. True or false? Answer: true. Rationale: insulin pumps provide continuous insulin delivery, mimicking the body's natural release of insulin. They are commonly used in type 1 diabetes, though some type 2 patients may also use them in specific cases. 207. Diabetic patients can safely consume sugary foods and beverages if they are taken with insulin. True or false? Answer: false. Rationale: while insulin helps manage blood sugar levels, consuming large amounts of sugary foods can cause blood glucose spikes. It is still essential for diabetic patients to limit sugar intake and follow a balanced diet. 208. Insulin resistance occurs when the body produces insulin but cannot effectively use it. True or false? Answer: true. Rationale: insulin resistance refers to the condition where cells in the body do not respond effectively to insulin, leading to higher blood glucose levels, which is characteristic of type 2 diabetes. 209. A HbA1c test provides information about blood glucose levels over the past 24 hours. True or false? Answer: false. Rationale: the HbA1c test reflects average blood glucose levels over the past 2 to 3 months, not just the past 24 hours. It is used to monitor long-term glucose control. 210. Type 2 diabetes is primarily caused by an autoimmune response that destroys insulin-producing cells in the pancreas. True or false? Answer: false. Rationale: type 2 diabetes is primarily caused by insulin resistance and often combined with pancreatic beta cell dysfunction, not by an autoimmune destruction of insulin-producing cells, which occurs in type 1 diabetes. 211. Diabetic patients should avoid all fats to prevent weight gain and manage blood glucose levels. True or false? Answer: false. Rationale: diabetic patients should focus on healthy fats, such as those found in avocados and olive oil, as part of a balanced diet. Unhealthy fats, like trans fats, should be avoided. 212. Diabetic retinopathy is a complication that affects the eyes and can lead to blindness if untreated. True or false? Answer: true. Rationale: diabetic retinopathy involves damage to the blood vessels in the retina and can lead to vision impairment or blindness if not managed through proper blood glucose control and regular eye exams. 213. Glycemic index is a measure of how quickly foods raise blood glucose levels after eating. True or false? Answer: true. Rationale: the glycemic index, GI, ranks foods based on how quickly they raise blood glucose levels. Foods with a high GI cause rapid spikes in blood sugar, while those with a low GI cause gradual increases. 214. Diabetic ketoacidosis, DKA, typically causes the patient to become hypothermic, low body temperature. True or false? Answer: false. Rationale: DKA typically causes hyperthermia, high body temperature, or normal body temperature, not hypothermia. It is marked by dehydration, metabolic acidosis, and ketosis. 215. The main goal of diabetes management is to normalize blood glucose levels and reduce the risk of complications. True or false? Answer: true. Rationale: the main goal is to achieve stable blood glucose levels within a target range, which helps prevent complications such as neuropathy, retinopathy, and kidney disease. 216. Metformin is contraindicated in patients with kidney dysfunction due to the risk of lactic acidosis. True or false? Answer: true. Rationale: metformin should be used cautiously or avoided in patients with impaired kidney function, as it can lead to lactic acidosis, a rare but serious side effect. 217. Diabetic patients should avoid consuming alcohol as it can cause sudden drops in blood sugar levels. True or false? Answer: false. Rationale: while alcohol can cause blood sugar fluctuations, moderate consumption is generally safe for most diabetic patients, as long as blood glucose is monitored and carbohydrate intake is adjusted. 218. Patients with diabetes are at higher risk for developing periodontal disease due to high blood glucose levels. True or false? Answer: true. Rationale: high blood glucose levels can impair immune function and reduce blood flow to the gums, increasing the risk of periodontal disease in diabetic patients. 219. The goal of insulin therapy is to provide the body with the insulin it is unable to produce due to pancreatic dysfunction. True or false? Answer: true. Rationale: insulin therapy aims to replace or supplement the body's natural insulin production, particularly in type 1 diabetes, where the pancreas no longer produces insulin. 220. Insulin resistance can be improved by adopting a low-carbohydrate, high-protein diet. True or false? Answer: false. Rationale: while a balanced diet with controlled carbohydrate intake can help improve insulin resistance, a high-protein diet alone may not be effective and could strain kidney function in the long term. 221. Diabetic patients with hypoglycemia should consume a source of simple carbohydrates, such as juice or glucose tablets. True or false? Answer: true. Rationale: simple carbohydrates like juice or glucose tablets provide a rapid increase in blood glucose levels, which is essential during hypoglycemia to restore normal levels. 222. The primary complication of diabetes that affects the kidneys is diabetic nephropathy. True or false? Answer: true. Rationale: diabetic nephropathy is the primary kidney-related complication of diabetes, leading to decreased kidney function and, eventually, kidney failure, if not managed effectively. 223. If a diabetic patient develops a wound, they should avoid using antibiotics unless the wound becomes infected. True or false? Answer: false. Rationale: diabetic patients with wounds should promptly seek medical attention, as they are at higher risk of infection. Prophylactic antibiotic treatment may be necessary depending on the severity and risk of infection. 224. The use of a short-acting insulin regimen is most effective in controlling blood glucose levels during meals. True or false? Answer: true. Rationale: short-acting insulin, e.g., regular insulin, is designed to cover blood glucose spikes following meals, providing quick action to manage postprandial glucose levels. 225. Diabetic patients should avoid exercise when blood glucose levels are below 70 mg per deciliter to prevent hypoglycemia. True or false? Answer: true. Rationale: exercising when blood glucose levels are too low, below 70 mg per deciliter, can cause further drops in glucose, leading to hypoglycemia. 226. Diabetic nephropathy is typically diagnosed based on a blood test measuring serum creatinine levels. True or false? Answer: false. Rationale: diabetic nephropathy is typically diagnosed through urine tests to measure albumin to creatinine ratio, as protein in the urine is an early indicator of kidney damage. 227. People with diabetes are more likely to develop cataracts at an earlier age than those without diabetes. True or false? Answer: true. Rationale: high blood glucose levels can accelerate the formation of cataracts, increasing the likelihood of early development in diabetic individuals. 228. Diabetic neuropathy can be treated with antibiotics to manage nerve pain. True or false? Answer: false. Rationale: diabetic neuropathy is a nerve condition caused by prolonged hyperglycemia, and it is typically treated with pain management, including anticonvulsants or antidepressants, not antibiotics. 229. The use of sodium glucose cotransporter 2, SGLT2, inhibitors can help lower blood glucose levels in both type 1 and type 2 diabetes. True or false? Answer: false. Rationale: SGLT2 inhibitors are primarily used in type 2 diabetes, and their use in type 1 diabetes is generally avoided due to an increased risk of diabetic ketoacidosis, DKA. 230. Diabetic patients with foot ulcers should be encouraged to walk as much as possible to promote circulation and healing. True or false? Answer: false. Rationale: diabetic patients with foot ulcers should avoid putting pressure on the affected foot to prevent further injury. Proper wound care, offloading, and rest are essential for healing. 231. Diabetic patients who are on insulin therapy need to regularly monitor their blood glucose levels to adjust insulin doses as needed. True or false? Answer: true. Rationale: regular blood glucose monitoring is essential for diabetic patients on insulin therapy to ensure that insulin doses are appropriately adjusted based on their current glucose levels. 232. Diabetic patients should avoid consuming foods that contain high levels of potassium, as diabetes leads to hyperkalemia. True or false? Answer: false. Rationale: diabetes itself does not typically cause hyperkalemia. However, certain medications like ACE inhibitors may affect potassium levels, so it's important to monitor levels, but potassium-rich foods like bananas can be part of a healthy diet. 233. People with type 2 diabetes should aim to lose weight, as this can help improve insulin sensitivity. True or false? Answer: true. Rationale: weight loss in type 2 diabetes can improve insulin sensitivity, reduce insulin resistance, and help improve overall blood glucose control. 234. Diabetic patients should monitor their blood glucose levels at least once a day to avoid complications. True or false? Answer: false. Rationale: diabetic patients, especially those on insulin or oral medications, should monitor their blood glucose levels multiple times a day, including before and after meals, to ensure proper control and prevent complications. 235. Type 1 diabetes can be prevented by maintaining a healthy diet and regular exercise. True or false? Answer: false. Rationale: type 1 diabetes is an autoimmune disorder that destroys insulin-producing beta cells in the pancreas. It is not preventable through diet or exercise, unlike type 2 diabetes, which is influenced by lifestyle factors. 236. The use of insulin in type 1 diabetes helps to normalize blood glucose levels and prevent the development of diabetic complications. True or false? Answer: true. Rationale: insulin therapy is essential in type 1 diabetes to replace the insulin that the body no longer produces, helping to normalize blood glucose levels and reduce the risk of complications like retinopathy, neuropathy, and nephropathy. 237. The most common cause of hypoglycemia in diabetic patients is excessive carbohydrate intake. True or false? Answer: false. Rationale: hypoglycemia in diabetic patients is typically caused by an imbalance between insulin or medication dosage and carbohydrate intake, not excessive carbohydrate consumption. 238. Insulin therapy is required for the management of type 2 diabetes in all cases. True or false? Answer: false. Rationale: insulin therapy is not always required for type 2 diabetes. Lifestyle changes, oral medications, and other injectable agents, e.g., GLP-1 receptor agonists, can effectively control blood glucose in many cases. 239. Diabetic patients should not consume any carbohydrates to avoid increasing their blood glucose levels. True or false? Answer: false. Rationale: carbohydrates are a necessary part of a balanced diet, even for diabetic patients. The key is to manage the type and quantity of carbohydrates to avoid rapid blood glucose spikes. 240. Diabetic patients are at an increased risk of developing cardiovascular disease, including heart attacks and stroke. True or false? Answer: true. Rationale: chronic hyperglycemia in diabetes accelerates the development of atherosclerosis, increasing the risk of cardiovascular diseases such as heart attack and stroke. 241. Diabetic patients should never take over-the-counter medications without consulting their healthcare provider. True or false? Answer: true. Rationale: many over-the-counter medications, including decongestants and some pain relievers, can affect blood glucose levels or interact with diabetic medications, so consultation with a healthcare provider is important. 242. Diabetic neuropathy primarily affects the legs and feet, leading to pain, numbness, and weakness. True or false? Answer: true. Rationale: diabetic neuropathy most commonly affects the peripheral nerves, particularly in the feet and legs, causing symptoms like pain, numbness, tingling, and weakness. 243. The best time to exercise for a diabetic patient is immediately after meals to avoid hypoglycemia. True or false? Answer: false. Rationale: while exercise can lower blood glucose levels, it's typically better to exercise when blood glucose levels are stable. Exercising right after meals can cause fluctuations. Diabetic patients should monitor their blood glucose before and after exercise. 244. Patients with diabetes should monitor their blood glucose levels more frequently if they are ill or under stress. True or false? Answer: true. Rationale: illness and stress can elevate blood glucose levels due to the body's increased production of stress hormones like cortisol. More frequent monitoring helps adjust insulin or medication as needed. 245. Blood glucose levels in diabetic patients should be maintained within a narrow range to prevent both hyperglycemia and hypoglycemia. True or false? Answer: true. Rationale: maintaining blood glucose levels within a target range is important for preventing complications associated with both high hyperglycemia and low hypoglycemia blood glucose levels. 246. The main goal of managing diabetes in pregnant women is to prevent the baby from developing type 1 diabetes. True or false? Answer: false. Rationale: the goal of managing gestational diabetes is to maintain normal blood glucose levels to prevent complications such as macrosomia, large baby, not to prevent type 1 diabetes, which is unrelated to gestational diabetes. 247. Diabetic ketoacidosis, DKA, is a complication more common in type 2 diabetes than in type 1 diabetes. True or false? Answer: false. Rationale: DKA is more common in type 1 diabetes, where insulin deficiency leads to the breakdown of fat for energy, causing ketone production. Type 2 diabetes is more likely to present with hyperosmolar hyperglycemic state, HHS. 248. Hemoglobin A1C is used to assess a patient's long-term blood glucose control, with a target level of less than 6.5% for most diabetic patients. True or false? Answer: true. Rationale: hemoglobin A1C reflects average blood glucose levels over the past 2 to 3 months. A target of less than 6.5% is recommended for most diabetic patients to reduce the risk of complications. 249. Diabetic patients are advised to avoid foot injuries, as their ability to heal from wounds is impaired due to poor circulation and neuropathy. True or false? Answer: true. Rationale: poor circulation and neuropathy in diabetic patients can impair wound healing and increase the risk of infection, making it essential to prevent foot injuries and regularly inspect feet for cuts, blisters, and ulcers. 250. Diabetic patients on insulin should avoid alcohol completely, as it can interfere with insulin action. True or false? Answer: false. Rationale: while alcohol can affect blood glucose levels, moderate consumption is generally safe for diabetic patients when they monitor their glucose levels and adjust their insulin doses accordingly. Excessive alcohol consumption, however, can be dangerous.